guys, welcome back. We took a short break. There was a lot of information, I know, so bear with us. We're here once again with Dr. Anthony J. Thank you for being with us, who wrote the book Estrogeneration. If you have not read this was, for me, Doc, was a mind-blowing, life-changing book in terms of awareness and how things that you don't even know that are making you sick are definitely impacting your health. So we talked a lot about estrogenics. We defined them. We even labeled, some of the top 3 things where we find estrogenics in our food and our water and personal care products. And I think now is a good time to sort of switch into the actions of mechanism, right? Mechanism of action, sorry, and the disease states that estrogenics can cause and usually do.
Yeah, so very good. So I think when I read the book again, it made sense to me because I was saying, okay, estrogenics, now we understand they're bad, but how do they affect our hormonal system? And I think in your book, you talked about 5 different mechanisms, so let's go over those together.
Sure. Well, it's like I mentioned before, a good way to think about this is pregnancy and kind of a perversion of pregnancy, right? Like a natural pregnancy state. When a woman's estrogen rises really high, you see a lot of changes. Now, obviously as men, we're not getting pregnant here anytime soon, but you can, hopefully not, but you can disrupt our hormones and mimic that same pregnancy state where you get breast development, where you get low testosterone because you wouldn't have testosterone as a woman being pregnant. So a lot of this stuff keeps going back to testosterone, right? Because we're talking about the mental changes that you get if your testosterone is low. You see this in scientific studies. You see sexual apathy. You see actual apathy, just generally low energy. And that's what a lot of people, when they take testosterone, they talk about. They say, like, now I'm bursting with energy. I can't believe I had 30 years where I had 0 energy. It's shocking to people because it's so dramatic, that change. Yeah. And it erodes you slowly. It's not like an overnight thing with these estrogen chemicals. They're slowly eroding your energy. They're slowly eroding your health. So it's like looking in the mirror. If you look every day, you don't notice it. But if you're 7 years old and now you're 17, now you're 27, there's a huge difference in how you look. It just, you didn't notice it as you went along, and that happens to your health.
Yeah. I mean, but you did mention with babies mothers consuming estrogenics that within 9 months they develop breasts and even went through puberty, some of them. I think the youngest recorded pregnancy was a 9-year-old or something?
Yeah, usually age 9. They've seen a lot of girls going into puberty.
Right,
even as young as age 6 now, which is insane.
It's insane.
6 years old.
Yeah, it's becoming so common. They're trying to make the normal range for puberty age 9. There's medical journal articles arguing for this. The same way that medical journal articles argued that lower testosterone should be normalized because it's so common. Right? That lower vitamin D should be normalized because it's so common. Things like that. And that's happened. So it's not unprecedented to have somebody arguing in a medical journal that we should lower the normal range for puberty, and then have it actually happen. And now it's all of a sudden masked and covered up because now everybody just says it's normal.
So again, if I can go, so I think the why we decided to do this talk is because for us who've been in this hormone optimization world, so what we do, our clinic, is how to make you feel better. Despite age, despite toxin exposure. So testosterone is a big tool that we use for both men and women, because as we see, because of the onslaught of estrogenics that our body's exposed to, we have a drop of testosterone and everything that it comes with. So I'm gonna go over those 5 mechanisms of action, because it helped me a lot to be able to really conceptualize why estrogenics are so detrimental to our hormonal health. So in your book, again, the first mechanism of action is that estrogenics increase SHBG, sex hormone binding globulin. Again, all of our patients will know that when we do a blood test, that's one of the blood tests we do. Because what SHBG is, it is the carrier protein for testosterone. So estrogenics, including birth control pills and all the estrogenics that we talked about, increases your SHBG, so you have less free active testosterone. So we see that in our clinic a lot. A patient will come to us with all the symptoms of low T. His total testosterone is 600. He goes to his primary care doctor. They don't check a free testosterone because insurance usually doesn't cover that. We do it at our clinic. Total testosterone is 500-600. Free testosterone is 7. Normal is 6 to 30. So you're all the way there. So without checking that free T, we would have never made the diagnosis. So one mechanism, increase SHBG, decreases free T.
And just a quick thought on that, on the free testosterone level. or the range, right, being 6 to 30, you made a great point in your book where it says that's kind of like a doctor saying, well, in terms of exercise, you should run anywhere between 0.02 miles to 26 miles. I mean, the range is so ridiculous, right?
Yeah, tenfold range. Well, women's testosterone is even crazier because oftentimes it says 7 to 70, which is a tenfold range.
Wow.
That's like going jogging for 7 miles or 70 miles. That's a totally different experience.
Totally
And
different.
sometimes blood test companies say 0 to 70 for women or 0 to 100 for women, things like that.
Right.
Depends on the company, but I mean, it's just absurd.
Absurd. Absolutely.
Second mechanism of action that you described in your book is estrogenics can bind to the estrogen receptors and then create that negative feedback loop to the pituitary. So now our body is sensing that there's enough estrogen, now there's less FSH and LH, and then you have low T. So this is what we see secondary hypogonadism, which is the most common form of low T that we see. And we keep asking ourselves, why is this happening? We get guys in their 30s that come in with secondary hypogonadism, whereas conventional medicine will tell you that this only happens in late onset hypogonadism, guys who are 50 or 60. We're seeing it in our patients that are 30 and 40. So that
Even
mechanism,
younger than that, right?
even younger.
Even younger than
So that mechanism of action made sense to me. So when I see a low testosterone and a low LH and FSH, so the body, your pituitary, cannot respond to this low testosterone, and we don't have an answer, you know what? Estrogenics are at least partly to blame.
Yeah.
Mechanism number 3 that we started to talk about, the testosterone resistance, where now the estrogenics come and block the androgen receptors. So it doesn't matter how much testosterone you have floating around. If the receptor is blocked, as you said, your hockey analogy, where you put a cardboard in front. I don't care what numbers you have. If you have the phenotype of low T, and we know what the phenotype is, low energy, low motivation, decreased libido, decreased sex drive, depression, increased belly fat, all of those things. If you have that phenotype, the numbers don't tell the whole story.
Yeah.
Right?
And just to kind of bring that home for people in terms of testosterone values, we would never treat people this young, but we've had patients who were concerned about their sons because they were seeing these changes, their energy levels, their sort of ambition, and they never wanted to leave the house. They were very apathetic, which is one of the things that is mostly affected. And I mean, we're talking about 23, 21, and the latest one that we checked, 16 years old with levels of testosterone in the 200 range. I mean, that's 80-year-olds had more than that, right? So it's a crisis and what we call now an epidemic, right? So this is an area that we definitely need to focus on, especially for our viewer, so that you can understand how this is actually impacting your life on an everyday basis and your children.
Completely. So again, for me, I always now want to bring it back to testosterone because again, this is what we do a lot. We evaluate men and women, and testosterone is one of the biggest, most important tools to bring wellness. Right. So now we see the mechanism of action, and there was something in your book to me that was important. Because I think doctors and a lot of patients still think testosterone is just the hormone of muscles and sex. Right. They don't realize that testosterone is actually a brain hormone, and estrogen is a brain hormone, and a lot of the effects are with the brain receptors. Yeah. So in your book, you talked about apathy, right? And how phthalates have actually been shown to cause apathy. So tell me a little more about this and maybe the mechanism of action on this.
Yeah, well, I mean, part of the mechanism is just that we have receptors through our whole body with these estrogen receptors. So it's not like leptin, it's not like insulin or something where it's just in a few organs in our body. It's all over the place. We have receptors in the brain that pick up these hormones and they detect how much our levels are, and it's really altered if you alter these levels of hormones, especially sex apathy, right? So if you dose mice or rats or whatever animals, honestly, with these estrogen chemicals, you get sexual apathy. The females go into heat, they're not in pursuit, they don't care. Right. And that's what you see in our culture with a lot of males. Talk to these teenagers or 20-year-olds. It's crazy. It's completely reversed from the way it was 50 years ago. Right. It's the same thing. It's just unethical to dose humans with these chemicals because when you're dosing people, you would get into the toxic levels. That's when you get into the cancer-causing levels, so you can't be doing that in human studies.
Completely. So sexual apathy, decreased libido. So we have a lot of guys coming to the clinic. They're like, Doc, I don't have a problem with erections, but I just don't feel like doing anything. So sex becomes, again, sexual apathy. Are estrogenics partly responsible for this? I think we can say pretty strongly, yes.
Yes.
And besides sexual apathy, apathy for work, apathy to
that healthy
self-actualize, to do the best version of yourself. And actually, unfortunately, we're seeing this. The young men are unfortunately falling behind young women. I have 2 girls, so I'm a girl's dad. So I love girls. Girls are taking over. But studies, and you have that in your book, there's decreased admission rate into colleges for boys. Boys are not getting into science degrees like they used to. So females are now surpassing males in so many things. You put in your book, in the 1940s, 70% of college graduates or college that enrolled into college were males. Now it's about 40%. So apathy, not just sexual, and we see that in our clinic. When we have somebody comes in and tell us they're tired, no motivation, no ambition, we replace their testosterone. Man, they want to go out, they want to have sex, they want to perform, their job.
They feel back to what they used to.
They want that. So another study, we're going to interview Dr. Ramasamy today, urologist, who he has a study where his study showed that adolescents and young adult males, that's 15 to 25, I think, 20% incidence of low T. And the symptoms of low T in the younger population, it's tired and no motivation. And as you said, let's look at our young generation, 20s, that have this sexual apathy, work apathy, pleasure apathy. They have what we call anhedonia. Nothing gives them pleasure anymore. Dysthymia, depression. So you have all of those things happening because of the decrease of testosterone. And then now we can say we have a why. We have a reason why this is happening. Because conventional medicine is still saying, okay, his testosterone's on the lower side, but he doesn't have a chromosomal problem. He doesn't have a genetic problem. He doesn't have a pituitary problem.
He's not down.
So there's no reason for him to have low T. So why are you treating him? We need to get away from this.
Yeah, for sure.
Right? So,
and to your point, normal, what people consider normal today, which has been degrading and degrading and degrading year after year after year, including the lab ranges, right? That have also been degrading. But normal is definitely not optimal. Right?
Exactly. Oh yeah.
Normal is definitely not optimal.
Well, and obesity ties into this too, because if your testosterone goes down, like you said, you get more belly fat, you get just more weight gain in general, your metabolism goes down. And, a lot of people are blaming diet for that, and there's a big component there. But if your hormones are off, as you know, you give people hormone replacement, and that obesity oftentimes just disappears.
Yep.
And these hormones are super involved in your ability to burn fat. So there's kind of a dual issue going on with these estrogenics, these chemicals that are acting like estrogen. Number one, they're lowering your testosterone, so you're not burning fat as well. But then number two, they're actually triggering your body to store more fat.
Yeah.
So it's a combination of two problems, that's making a perfect storm here.
Yeah, and exacerbates over time, for sure.
And talking about this also, so remember I talked about the HPG axis, where the pituitary makes LH and FSH. LH stimulates the Leydig cells to make testosterone. FSH stimulates the Sertoli cells to make sperm.
Right.
So what are we seeing in our society now? Huge problem with infertility.
Yep.
Right?
Setting
So what's causing
new
this?
records every year.
Records.
Literally.
Shana Swan in her book Countdown showed that in the past 40 years, sperm count has decreased 52%.
53%.
Is that crazy? And so this is proven. So if fertility that's in the same HPG axis, FSH to Sertoli cells, there's a problem there. You'd better believe there's a problem with LH to Leydig cells and testosterone. Yeah. So fertility and testosterone are very closely related, and we're seeing an increased incidence of problems with both. Again, we can point fingers at, it's not the only cause, but the estrogenics are a big part for that.